Hi, good morning Brendan. My name is Ivana Millen. I'm your invigilator for the OET speaking session on the 21st of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Brendan Magnus.
And what is your candidate number, please?
My candidate number is 221043434.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Can you please tell me how your connections to coworkers or others help you to be successful in your work?
Having a positive relationship with my coworkers helps us work more collaboratively as a team. If I don't know something, I can always reach out to a coworker who in most cases does. I can reach out to them to help with tasks that need to be completed or to help put out fires in the community. If a client is having an issue or concern and I can't address it at the moment, I can reach out to a coworker who has time to do it. Connection in the community. Build those relationships for ease of referrals, of collaborating on treatment.
Tell me about a specific time when you had to handle a tough problem that challenged fairness or ethical issues.
Oftentimes, disclosure of confidential information. I am very aware of the policies and patient-doctor confidentiality. My parents have always taught me that information that is shared with you is an honor and is to be treated as sacred. This rule I always apply. However, there was an instance where I had to report one of my peers I was mentoring because she displayed suicidal symptoms in her idioms and language. It was difficult for me to break the confidentiality, but ethically, I did the responsible thing. And I could have very well saved her life.
Explain to me, what is your favorite type of patient?
A patient that is appreciative of the care they're receiving. A patient that cooperates and is willing to do what is necessary to improve upon what they are under our care. Of course, finding a perfect patient will not always happen. You have to adapt and be just as courteous to a patient, no matter how they behave.
How well do you work with other nurses, doctors, and staff?
Teamwork is a vital skill for anyone in the nursing field. It's important to express that you recognize the value of working together with doctors, other nurses, and staff members. Collaborating with coworkers can provide the best patient outcomes, ensure the effectiveness of safety procedures, and increase job satisfaction. During my clinical training at City Hospital in the ER, I learned how important it is to communicate well with other nurses. One night, a patient approached me to say he had been waiting for his medication for 20 minutes. I was new to the hospital at the time, so I checked in with his nurse before deciding to provide it myself. It turned out that the patient had Alzheimer's disease, and his attending nurse had given him the medication already. This communication helped our team to ensure the patient's safety.
Tell me how you handle stressful situations as a ward nurse.
I try to step back and calm myself down first. Reach out to my peers or supervisor for support. Then, think of a plan to address the problem. I make sure to react to the situations and not to stress. For example, when we switched to a new documentation system, it was extremely stressful. There were aspects of the system we didn't understand. We had to transfer old notes and billing from the older system while maintaining normal daily duties. We didn't fully understand how to do some things. It was insane and I felt extremely overwhelmed. I met with my supervisor and expressed how I was feeling, cried, and that made a huge difference. After getting past the emotions, I was able to just accept what couldn't be done at the moment and accomplish what I could get done, ask the right questions and got answers.
Great. Thank you very much for sharing that. So, Let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Excuse me, please. Can I have a name for the child?
You can use any name as you like.
Thank you.
No worries. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Hi, good evening. My name is Brendling Magnus, one of the nurses in the department. And am I talking to Elise's parents?
Yes, I am Elise's mother.
All right. May I know your name, please?
You can call me Macbeth.
Hi, Macbeth. I am the nurse attending your daughter.
How is she now?
Don't panic, Macbeth. She is in our safe hands. We have provided first aid. And she is getting better now.
Okay. From your words I can understand that none of the doctors visited my daughter yet. Please do something to save my daughter. Please.
Macbeth, I really acknowledge your situation. However, you should understand that the emergency department has been busy. And as soon as a doctor becomes available, the doctor will be over to see your child.
Oh, is it? Will the doctor take much time to see my daughter?
I can realize your worries. But Macbeth, there is no point to panic at this moment. The doctor will attend Elisa shortly. Meanwhile, I need your cooperation to know some basic details about Elisa.
Sure. Of course. What should I do, nurse?
Thank you for your consent. Could you please brief on your daughter's condition?
Sure. What would you like to know?
Is it the first time she is getting this attack?
Yes, this is for the first time she is coming across the situation.
Could you please explain to me how she was feeling during that time?
Yes, if I remember correctly. She was playing with her pet dog, and suddenly, she pointed to pain in the chest, and began to feel breathing difficulty. Later on the way to the hospital, she began to make a whistling sound while breathing.
Okay, noted Macbeth. Does she have any other allergic condition?
Not yet, nurse.
Do you have pet birds, or do you raise pigeons?
No. We only have a pet dog.
Can you relate if anything seems to trigger the breathlessness?
There seems nothing unusual has happened.
All right, thank you for your cooperation, Macbeth.
Nurse, I am afraid. What might have happened to my child?
I can perceive your feelings. Calm down, Macbeth. Your daughter will be all right. We are here to help you. The doctor will be attending to her shortly.
Nurse, does the doctor could figure out the exact cause for breathlessness, and make my daughter feel better soon?
Sure, the doctor will provide a diagnosis after a thorough medical assessment, which will initiate the prescribed treatment and care, essential for your daughter to be better.
I am becoming more anxious, as the doctor is getting delayed, to consult my daughter.
I acknowledge your anxiousness. The doctor will consult her very soon. However, I can assure you that we have done the first aid, and are doing everything possible to take care of your daughter. Also, the child is stable right now.
Okay, I understand your effort, nurse. I wish I could see my daughter.
I appreciate why you think that, but our hospital policies will not permit it. You just relax, Macbeth. Your daughter is safe. Now, please let me be with your daughter. I will update you as the doctor consults her.
Okay. Please ask the doctor to consult my daughter as early as possible.
We have made the arrangements already, Macbeth. Definitely the doctor will consult her in a moment. Now, I have to take her vital signs to report to the doctor. It will help the doctor in assessment.
Okay, nurse. You may please.
Thank you for your understanding. Don't worry, she will be back to her old self in no time.
Thank you, nurse. That's the end of your OHT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.